Cervical cancer is the abnormal and uncontrolled growth of cells in the cervix. Cervix is the neck of the womb and connect vagina to the womb. These abnormal cells refuse to die and continue growing, eventually forming lump or tumor, affecting part or the whole of the cervix initially and subsequently adjacent organs like the womb, bladder, and rectum. It may also spread to the bones, lungs, liver, and brain. Part of this lump is usually taken and look under microscope to make diagnosis of the disease. Majority of cervical cancer is caused by infection with human papillomavirus. The infection is sexually transmitted. Up to 80% of women will acquire human papillomavirus infection in their lifetime. The good thing is that up to 90% of infected women with good immune system will clear this virus within 2 years. The immune system is the cells in our body that fight and kill germs that enter our body. It is only in few women that this infection persists and can lead to changes in the cells of the cervix. This is called pre-cancer stage. This pre-cancer stage can last up to 10 to 15 years before it finally becomes cancer. This ample time provides the opportunity for screening and identification of this pre-cancer stage and treat before it becomes cancer. Unfortunately, women in developing countries lack access to this screening and come down with cancer. There are certain habits that predispose women to acquiring human papillomavirus infection and later on develop cervical cancer. These include early age at sexual intercourse, multiple sexual partners, and having partner with multiple sexual partners. The risk of having the cancer is also higher in those whose immune system is weak and unable to fight the virus. These group of people, including those who have HIV, who use steroid for prolonged period, those on cytotoxic medications, and those who smoke. It is good to know that a large proportion of women with cancer may not have any risk, and having cancer is not their fault. In early stage of disease, there are usually no symptoms, and the disease is very hard to detect. The disease in advanced or late stage may present with abnormal vaginal bleeding in form of bleeding in between menses, during and after sexual intercourse, and bleeding after menopause. Other symptoms include watery, foul-smelling vaginal discharge, lower back and abdominal pain. If you notice any of these symptoms, please see your doctor. Cervical cancer is one cancer that can be prevented through behavioral modification, vaccination, and screening and treatment of precancer stage. The behavioral modification to prevent or minimize the risk of cervical cancer include avoidance of multiple sexual partners, avoidance of sexual intercourse before 17 years of age, regular and consistent use of condom during sex, and stop smoking. One of the success stories of vaccination is the eradication of smallpox since 1980. Similar story can be replicated for cervical cancer, as vaccine has also been developed targeting human papillomavirus that causes majority of the cancer. This vaccine is available and effective. It is recommended to be administered to boys and girls between 9 and 14 years. However, it can also be given after 14 years. This vaccine fight and kill human papillomavirus that comes into the body. Another success story in the elimination of cervical cancer is mass screening to detect the disease in precancer stage and offer appropriate treatment. This approach has reduced the number of cervical cancers in developed countries, unlike in developing countries like ours, where it is not widely implemented. These screening tests include PAPS test, liquid-based cytology, HPV DNA test, and visual inspection of the cervix after application of some chemicals. These tests detect these abnormal cells in precancer stage. The abnormal screening tests are subjected to other tests and are treated based on the severity. This treatment is effective and curative. This screening test is recommended for women older than 21 years or after 3 years of starting sexual intercourse, and it is usually done every 3 to 5 years. If you are in this age group, ask your doctor for any of these tests. Treatment depends on the stage of disease at diagnosis. The option includes surgery, chemotherapy, and radiotherapy. Combination of these modalities may be required. Treatment when the disease is still confined to the cervix has a good success rate with higher chances of survival than when it has spread beyond the cervix. Kindly subscribe to this channel for similar videos and share it with friends and family.